There are 12 cranial nerves. The first cranial nerve is the olfactory nerve, which is the function of this nerve is the sense of smell. This originates in the telencephalon of the cerebral cortex and is a sensory nerve. It's significant clinically because if a client shows anosmia or partial or complete loss of smell, then we can determine it is a impairment of the olfactory nerve. The second cranial nerve is the optic nerve. The function of this nerve is vision. It originates in the diencephalon of the cerebral cortex and is a sensory nerve. It's clinically significant because if a client shows partial or complete blindness or visual field deficits, we could determine there is a impairment in the optic nerve. The third cranial nerve is the oculomotor nerve. The function of this nerve is eyelid opening, eyeball movement, pupil size. It originates in the mesencephalon of the midbrain and is a motor nerve. So it's significant because if a client shows ptosis, that can determine an impairment in the oculomotor nerve. The fourth cranial nerve is the trochlear nerve. The function of the trochlear nerve is eye movement, so depression and adduction of the eye. It originates in the mesencephalon again, so the midbrain. It's a motor nerve, and it's clinically significant because if a client shows weakness or paralysis in the superior oblique muscles, that can determine an impairment in the trochlear nerve. The fifth cranial nerve is a trigeminal nerve. This is responsible for the function of chewing and then face and mouth sensation. So it originates in the pons and is both motor and sensory. It's significant clinically because if a client shows like decreased sensation to the face, oral cavity, or like decreased movement for mastication, it can determine an impairment in the trigeminal nerve. The sixth cranial nerve is the abducens, and the function of this is eye movement, originating in the pons, and it is a motor nerve. It is significant clinically because if there is an impairment here, a client would experience diplopia or double vision. The seventh cranial nerve is the facial nerve, which has the function of facial expression, taste, and then secretion of tears or saliva. So this originates in the pons and is both motor and sensory. It's significant clinically because if a patient shows decreased facial expressions and decreased sensation of the tongue, of the front of the tongue, or decreased saliva production, then there is a impairment in the facial nerve. The eighth cranial nerve is the vestibulocochlear nerve, and this is the function of hearing. It originates in the pons and is a sensory nerve, and it's clinically significant because if a client has hearing loss or balance problems, there is an impairment in the vestibulocochlear nerve. The glossopharyngeal nerve has the function of taste, so it senses carotid blood pressure, originates in the medulla oblongata, and is both sensory and motor. So if a client shows like decreased taste to the back of the tongue, loss of gag reflex, excessive drooling, this is an impairment in the glossopharyngeal nerve. The 10th cranial nerve is the vagus nerve. It senses it senses aortic blood pressure, heart rate, stimulates digestive organs, and originates in the medulla oblongata of the brainstem, and is both motor and sensory. It's clinically significant because if there is an impairment here, a patient can experience injury to the pharyngeal branch, which causes paralysis of the pharynx and the soft palate, dysphagia, harsh voice, etc., which is a impairment of the vagus nerve. The 11th cranial nerve is the accessory or spinal cranial nerve, and the function is trapezius sternocleidomastoid. Head movement, swallowing movements, originates in the medulla oblongata of the brainstem, and it is motor. It's clinically significant because if a client has difficulty like turning their head, this is a sign that there is an impairment in the accessory nerve. And then hypoglossal nerve is the 10th cranial nerve with the function of tongue movements, originates in the medulla oblongata, and it is a motor nerve. It's clinically significant because if a client shows like decreased lingual movement necessary for speech and bolus formation and swallowing, there is an impairment in the 12th cranial nerve. So as a visual, I like to use this drawing, and it has like all of the numbers of the cranial nerves and representing like where they are their functions are. The blue is like the sensory, the pink is the motor nerves, and then the purple are both. So for example, number 1 is right here because it's the optic nerve and it's responsible for the sense of smell, which is sensory, so I have it right here. Same thing for the optic nerve is number 2, which is responsible for vision, and it is the sensory. And then like number 3, the oculomotor, is like eyelid opening, eyeball movement, and pupil size, which is motor, and so on. So I find this very helpful in visualizing the nerves and their functions.